so grateful that we can come and celebrate together World TB Day. I was sitting there, then I realized there was a song we used to sing, and I wish after this, before we head off, that we'll get all the people who know this song and we can sing it to the patients. I don't know if you remember it, I've vibered it to you. It's called Vondoma Nandikewa. Yes? You remember that song? So Dr. Kama will vibrate to you so that we can sing it after this. So it's a song that we used to sing a lot here in Tamavua, because it is a song about a patient who came from Vunulevu and came all the way to Suva, brought up to Tamavua, and back in the days when you had TB, it was gone. You were gone. That was the thinking back in the days. You were gone. So they used to sing this song. And back in the days when they think of Tamavua, they used to think of Tamavua as being both a Valenimbula and a Valenimati. Because you didn't know whether you're going to come back. It was like going to, when people went to Makungai for leprosy. It was bye-bye, that's it, finished. They used to, I hear stories in Laos that they used to come and hug and they say farewell like you're gone forever. And that's all changed. And today we're observing World TB Day, and we're also observing today the successes that we've had with TB. And I think that's important to understand. That because 25 years ago this place was full, was telling us it was active with a lot of work around TB and leprosy. And the reason why it's emptier now is because a lot of good work has been done over the intervening years up until today. Okay? And we all understand that TB is caused by bacteria and is diagnosed by an array of WHO recommended laboratory tests, and they keep on getting smarter and smarter. And I'm very, very excited about the fact that we also grow in that field in terms of being able to find the imaging techniques and also the laboratory tests to be able to move with the time. One important thing is TB is curative, is curable, and the medications are free of charge. And now government has made it very clear that it will leave no Fijian behind. And so this morning I've come here because you may have a disease that only a few people have, but government will not hold back in making sure that you receive all the treatment that you need to get. And we know also that the medication which is we've taken devotedly for a period of 6 months will actually, or more, will actually lead to a cure. We've talked about this morning about the prevailing global data around in WHO that TB is among the 10 causes of death worldwide. We are pleased to say that there are many other countries around the world that are struggling with the re-emergence of TB, with multi-drug resistance of TB, and also by the fact that there are multiple comorbidities happening at the same time. So HIV and TB, for example. And so while we may see sporadic events of this in Fiji, we don't see it on a scale that many see it in some other geographical locations around the world. As I've alluded to earlier, TB is not new to Fiji. It's been causing disease and claiming lives. And since 1960s, in the 1960s was the heydays of TB. Fiji had a high burden, was a high burden country with respect to TB. And earlier on in the 1950s, we had a lot of mortality around TB. And I think this song that I was talking to was probably written around this time. And the way that it was treated then was to isolate them and treat them. And we all, for those of you who work here, you will know the story about the mobile x-rays. And I work with an old professor called Professor McKay. And he always talks about the mobile x-rays because Professor McKay is an orthopedic surgeon. So they do a lot of x-rays. So he talks about the mobile x-rays. And I'm sitting and I'm thinking, wow, back in the 1960s, 1970s, they had mobile x-rays going around the country taking x-rays. So you can see that we've been building on all that good work up until now. You can also imagine that if we haven't been, actually putting a lot of mind and effort and investment around the treatment of TB, especially within the last 20 years, then it will be a completely different story today. It'll be wards that are full, new buildings, all dedicated to TB. So the outcomes, though we may say are mixed and they're changing dynamics, I would say this morning that we are doing a relatively good job. And it's a testament to the hard work that our TB people are doing, the doctors, the nurses, but the support that they have up in Tamavua. Because Tamavua is not only about TB, it's about leprosy, it's about rehab, and all this coming together is supporting the work around TB. In 2018, we estimated that 5 out of every 10,000 Fijians around the country had TB. Is that Takoi? Not Takoi. Well, I'm going to Lubuka tonight, Takoi. The Subalami corridor was reported to have 9 out of 10,000 Fijians having TB. So while all around Fiji, it's about 5 out of 10, in the Laminosori corridor, it was actually a bit more. There are other localities in Fiji which demonstrate a growing burden over the disease, and to counter the new challenges and the dynamics of TB transmission in Fiji has transpired since 1950, the National TB Control Program. And Dr. Mbera is, as alluded to earlier by Dr. Kama, is one of the champions of the National TB Program. Some of the doctors and a lot of the nurses involved in this have left us, but we are grateful that those that have remained have been able to pass on those skills around the work of TB. And the work around communicable diseases such as, which is long-standing like TB, in my humble opinion, is similar to surgery. I'm a surgeon. So as much as we say we got fancy tools, we can do this way, we can do that, at the end of the day, we're very reliant on the experience that the older surgeons give us. And that's the same thing with chronic communicable diseases like TB. As much as we've grown in terms of the interventions, in terms of the science around it, but also at the same time, we are actually very dependent on the experience that those who have gone before us can be able to live with us. And that's why Dr. Berra is still with us in providing mentorship around that area. The Ministry of Health recognizes that aside from the biological implications, TB also has social implications. For example, one may not be at home with loved ones for a period of time as they begin the initial DOTS part of the program. So it's an all-of-society approach. It's not only a TB unit approach. It's not only a Tamavua Hospital approach. It's not only a Ministry of Health approach or WHO approach. It needs an all-of-society approach. And World TB Day commemorates the global community's response to the impact of the disease on our lives. And the theme for today, it's time to end it in my generation. There's been 3 generations of TB, or 4, 60 years. So I'm estimating if about 20 years per generation, 20 years. Because we have children at about 20-something, not at 60-something. So it's about 3 generations. So I'm thinking that it's time to end it in TB in my generation is a very apt theme. So 25 years ago, I was a medical student, there was a lot of TB. Now there's still TB, and maybe we need to get behind this and say, this is it. My children, my grandchildren will not see TB. They will not hear of TB. And so to drive this and to set a platform, the ministry is working with other stakeholders, the Ministry of Education. I note that today there are 20 stations around Fiji where this is being celebrated and there's awareness on TB. In the Central Division, which is being celebrated in the Mosi Wenbokasi, QBS, Wailoku, and here in Tamavua Hospital. The World TB Day, we anticipate everyone to actively take part in and help us to advocate for TB by informing our communities. So I urge you this morning, those who may have TB, when you go back, you talk about it. And also informing our classmates, our work colleagues, and family that TB is curable. And reflecting and reiterating, it's time to end TB in my generation. I bid you ample success. I wish you all the best. And my office is always open to opportunities to discuss with one on how best we can be able to end this in our generation. and and look at ways in which we can work together. I want to end by saying there's been a lot of good work done. And I also want to end by saying there's still a lot of good work to be done. And I know we have the right people to do the work. Thank you very much for this opportunity. Thank you for the lovely speech this morning by our patient. It was great to hear her talk this morning and to give her views. And I was so glad to listen to your talk this morning. Thank you very much. God bless you. And I look forward to singing that song with the staff. The patients can wait.